Imagine the following. Every day, your blood vessels and heart are exposed to millions of small stresses. Cholesterol, inflammation, and oxidative stress all imperceptibly destroy your arteries, creating a risk of heart attack, stroke, and other chronic diseases. But there is a way to change all this. And this method has been proven in practice by a well-known cardiologist, surgeon, and expert in preventive medicine, Dr. Caldwell Esselstyn, who is already over 90 years old. His research shows that nutrition can be not just fuel, but a real medicine that can prevent cardiovascular diseases and reduce the risk of cancer. Dr. Caldwell Esselstyn devoted decades of his life to the in-depth study of coronary heart disease and came to a conclusion that shocked the medical community at the time. Based on clinical observations, long-term practice at the Cleveland Clinic, and analysis of epidemiological data, he showed that the key cause of atherosclerosis is not age, genetics, or stress levels, as is commonly believed, but daily nutrition. According to him, the traditional Western diet, saturated with meat, dairy products, eggs, oils, and processed fats, directly damages the endothelium, the thin inner layer of blood vessels responsible for their elasticity and health. The damaged endothelium loses its ability to produce nitric oxide, which causes the vessels to narrow, increases inflammation, and begins the accumulation of cholesterol plaques. Esselstyn emphasized that surgical methods, bypass surgery, stents, and drug therapy, do not eliminate the root cause of the disease. They only temporarily improve blood flow, but do not stop the pathological process itself. In his research, he demonstrated that while maintaining the same diet, the disease continues to progress, even after the most modern operations. That is why he proposed a fundamentally different approach: the complete elimination of factors that destroy blood vessels. His nutrition program is based on whole plant foods, excludes all animal products, added oils, and sources of saturated fats. According to the results of his clinical observations, patients who strictly adhered to this approach not only stopped developing the disease, but in some cases partially restored vascular function and reduced cardiovascular risks. His nutrition program has produced results that have long been considered impossible in cardiology. In his clinical observations, Caldwell Esselstyn worked with patients who had already been diagnosed with severe coronary heart disease, many of whom had suffered heart attacks, bypass surgery, and stent placement. These were people to whom traditional medicine could offer virtually nothing except lifelong medication and the risk of recurrent cardiac events. However, with strict adherence to a low-fat, whole plant-based diet that almost completely eliminated meat, dairy products, eggs, and added oils, these patients began to experience startling changes. The level of total cholesterol in most of them steadily decreased below 150 milligrams per deciliter, and the level of LDL, the so-called bad cholesterol, dropped below 80 milligrams per deciliter, values at which the development of atherosclerosis practically stops. But even more important was the clinical improvement. Patients reported the disappearance of chest pain, improved endurance, and the return of the ability to walk and do daily activities without fear of an attack. During the following years of follow-up, there were practically no repeated heart attacks and serious cardiovascular complications in this group. Esselstyn emphasized that this effect was not temporary and was not related to the miraculous effect of a single product. It persisted for years, as long as people adhered to their chosen diet. These data have become a strong argument in favor of the idea that atherosclerosis is not an irreversible aging process, but a disease directly dependent on daily dietary decisions that can not only be stopped, but also partially reversed. Breakfast plays a key role in this process because it is the first meal that sets the metabolic direction for the whole day. In the morning, the body is especially sensitive to what signals it receives, either a signal of inflammation and vascular overload or a signal of recovery and protection. Caldwell Esselstyn always emphasized that if a person starts the day with food that supports endothelial function, he literally reduces the risk of vascular damage from the very first hours. The endothelium is the thinnest layer of cells lining the inner surface of blood vessels, and it depends on its condition whether the vessels expand freely or the plaque formation process begins. In this context, oatmeal is considered an almost ideal breakfast base. It is rich in soluble fiber, primarily beta-glucan, which binds excess cholesterol in the intestine and promotes its excretion, preventing it from entering the bloodstream. This reduces the level of LDL, the main factor of vascular wall damage. But the value of oatmeal is not limited to fiber. It contains the unique antioxidants avenanthramides, which reduce inflammation, protect the endothelium from oxidative stress, and help blood vessels maintain elasticity. Such a breakfast does not cause sudden spikes in sugar and insulin, does not overload digestion, and creates conditions under which blood vessels work in a gentle mode throughout the day. That's why Esselstyn called his morning bowl of oatmeal not just a meal, but a daily therapy for the heart, accessible to everyone without drugs or surgery. To enhance the protective effect of such a breakfast, Caldwell Esselstyn always emphasizes the importance of adding fresh berries. Blueberries, strawberries, raspberries, and blackberries are not just a delicious addition, but a powerful tool for vascular support at the cellular level. These berries are rich in polyphenols, anthocyanins, and vitamin C, substances that directly reduce oxidative stress, which is one of the key causes of endothelial damage. It is oxidation that triggers a chain of events leading to inflammation, loss of vascular elasticity, and the formation of atherosclerotic plaques. Anthocyanins, which give berries a rich, dark color, improve the production of nitric oxide, a molecule that helps blood vessels relax and expand. This lowers blood pressure, improves blood flow, and reduces stress on the heart. In addition, berries contain a significant amount of dietary fiber, which slows down the absorption of sugar and prevents sudden spikes in blood glucose. This is especially important in the morning when a sharp rise in sugar can damage endothelial cells in the early hours of the day. Esselstyn also emphasized that berries work most effectively in their whole form. When a person eats berries whole, along with the skin and pulp, the body receives a full range of protective substances in a natural balance. Unlike juices, which act as a sugar shock to blood vessels, whole berries nourish, protect, and regenerate. In the long run, such a simple breakfast item helps slow down vascular aging, reduce the risk of heart attacks, and create conditions under which the heart can work stably and without overloading for years. Fruits with a low glycemic index, such as apples and pears, were considered by Caldwell Esselstyn as a safe and physiologically correct way to add sweetness to the diet without harm to blood vessels. Unlike juices and processed fruit products, whole fruits contain natural fiber, which slows down sugar absorption and protects endothelial cells from sudden glucose spikes. Such jumps, according to numerous studies, cause micro damage to the inner wall of blood vessels and accelerate the development of atherosclerosis over time. Apples and pears are rich in pectins, soluble fibers that bind excess cholesterol in the intestine and promote its elimination from the body. This directly reduces the concentration of LDL in the blood, which is one of the key factors in the prevention of coronary heart disease. In addition, these fruits contain flavonoids and polyphenols, which have a pronounced anti-inflammatory effect. They reduce oxidative stress, improve vascular function, and maintain arterial elasticity. Esselstyn emphasized the importance of eating fruits in their whole form. When a fruit is chewed rather than drunk, a complex hormonal satiety reaction is activated, which prevents overeating and excessive stress on the metabolism. This approach helps to maintain a stable energy level throughout the day without sudden ups and downs, and creates conditions under which blood vessels operate in a gentle mode. In the long run, regularly including apples and pears in breakfast becomes a simple but powerful tool for protecting the heart and preventing chronic diseases. Dr. Caldwell Esselstyn has been emphasizing one key idea for decades. The body doesn't need radical shakeups, it needs consistency. It is systematic, seemingly small changes in nutrition that trigger deep recovery processes. When a person gradually abandons animal products and switches to whole plant food sources, whole grains, legumes, vegetables, fruits, the body gets a chance to return to its natural state of health. This is not a theory, but conclusions based on clinical observations and long-term recovery programs for patients with severe forms of coronary heart disease. Reducing the intake of saturated fats and added sugar leads to a dramatic decrease in blood cholesterol levels, especially low-density lipoproteins, which damage the endothelium. Esselstyn has repeatedly shown that when cholesterol levels are below a critical threshold, endothelial cells begin to recover, the vascular wall stops being inflamed, and blood flow improves naturally. The inflammation that underlies atherosclerosis gradually subsides, and the vessels regain elasticity lost over the years of malnutrition. It is especially important that these changes do not require medical interventions or complex procedures. The heart begins to receive support not from the outside, but from the inside, through nutrition, which does not destroy but nourishes the vascular system. According to Esselstyn, this approach explains why his patients eventually lost the need for bypass surgery, stents, and constant medication. A consistent diet of whole plant foods turns into a powerful tool not just for prevention, but for the real restoration of the cardiovascular system. A plant-based diet has a powerful protective effect not only on the heart and blood vessels, but also on the mechanisms that are directly related to the development of cancer. One of the key causes of cancer is considered to be chronic inflammation in the body. It can go unnoticed for years, damaging tissues and creating a favorable environment for cell mutations. A diet rich in animal fats, processed foods, and sugar increases this inflammation, while whole plant foods, on the contrary, help reduce it. Oxidative stress is another important risk factor. Free radicals damage the DNA of cells, disrupting their normal division. Fruits, vegetables, greens, legumes, and whole grains contain high amounts of antioxidants that neutralize free radicals and protect cells from damage. In addition, plant foods are rich in phytochemicals, natural compounds that can slow down the growth of tumor cells and even trigger their self-destruction. Fiber plays a special role in the prevention of cancer, especially intestinal cancer. It improves the functioning of the digestive system, promotes the elimination of toxins, and supports a healthy intestinal microflora, which directly affects the immune system. A strong immune system is able to recognize and destroy atypical cells faster, preventing the disease from developing. That is why regular consumption of whole plant foods is considered one of the most effective and natural ways to reduce the risk of cancer and maintain health for many years to come. Esselstyn emphasizes that it is the eating habits established at a young age that shape the condition of blood vessels for decades to come. The body very early begins to remember the type of food that a person consumes daily. If, since childhood, the diet is based on foods high in saturated fats, cholesterol, processed oils, and refined sugar, this gradually damages the endothelium, the thin inner layer of blood vessels. These micro injuries do not cause pain or obvious symptoms, but over time, the vessels lose elasticity, become stiff and vulnerable to inflammatory processes. Against this background, normal blood flow is disrupted, nutrition of tissues and organs deteriorates, and atherosclerotic changes can begin long before the first clinical signs of the disease appear. The most dangerous thing is that this process develops slowly and almost imperceptibly, creating the illusion of normal health. That's why Esselstyn focuses on daily routine meals, especially at breakfast. He believes that breakfast should be not just a source of calories or pleasure, but a functional meal that supports vascular health, reduces inflammation, and creates favorable conditions for the heart. A well-chosen breakfast based on whole plant foods is able to gently restore the endothelium every day, improve vascular elasticity, and reduce the risks of cardiovascular diseases. In the long run, it is these seemingly insignificant decisions that shape either health for years to come or the ground for chronic diseases. Flax and chia seeds occupy a special place in the nutritional system, which Caldwell Esselstyn calls protective for blood vessels. Despite their tiny size, these seeds contain a high concentration of biologically active substances that directly affect the health of the endothelium, the inner lining of blood vessels. First of all, these are vegetable omega-3 fatty acids, in particular alpha-linolenic acid. It is involved in reducing chronic inflammation, which is the basis of atherosclerosis, heart attacks, and strokes. In addition to omega-3, flax seeds are rich in lignans, unique phytonutrients with pronounced antioxidant properties. Studies show that lignans help reduce the level of bad LDL cholesterol and reduce the oxidation of lipids in the blood, thereby slowing damage to the vascular wall. Chia, in turn, contains a large amount of soluble fiber, which forms a gel-like mass upon contact with water. This gel slows down digestion, stabilizes blood sugar levels, and reduces the load on blood vessels after eating. Esselstyn emphasized that regular consumption of flax and chia seeds improves blood flow, lowers blood pressure, and supports normal endothelial function without medication. It is also important that these seeds do not contain cholesterol and saturated fats, which he considered the main enemies of blood vessels. By adding them to oatmeal, a person creates a morning meal that not only saturates, but literally works as a daily prevention of cardiovascular diseases, supporting heart and brain health for many years to come. Dr. Esselstyn emphasizes that nutrition should not be perceived as a restriction or punishment. On the contrary, a healthy diet is a way to enjoy eating while taking care of your body. The main principle of his approach is to choose whole plant foods rich in fiber, vitamins, minerals, and antioxidants that directly support the functioning of the heart and blood vessels. Such a diet not only reduces the risk of developing chronic diseases, including cardiovascular diseases and diabetes, but also helps maintain a normal weight, improves metabolism, and strengthens the immune system. Research shows that systematic adherence to the principles of nutrition promoted by Dr. Esselstyn produces amazing health results. People who follow a whole plant-based diet rich in fiber, vitamins, minerals, and antioxidants show healthier blood vessels, improved blood circulation, and stable blood pressure. This directly reduces the risk of developing cardiovascular diseases such as stroke, heart attack, and atherosclerosis. In addition, a diet rich in whole foods helps maintain a healthy weight, prevents obesity, and reduces the likelihood of type 2 diabetes. But the benefits of this diet are not limited only to the heart and metabolism. It has been proven that plant foods, especially berries, vegetables, and seeds, have a powerful antioxidant effect, which reduces the risk of developing certain types of cancer. They help fight inflammation, strengthen the immune system, and protect cells from oxidative stress, which is one of the key causes of aging and chronic diseases. The gradual introduction of such habits into daily life creates a stable effect of prevention and long-term protection of the body. In addition, Esselstyn nutrition is becoming a preventive tool that replaces expensive medical procedures and medications wherever possible. The effect accumulates over the years. Every day the body gradually recovers, blood vessels become more elastic, metabolism works more efficiently, and overall well-being improves markedly. Fatigue gradually decreases, energy increases, cognitive function and mood improve, which makes daily nutrition not just a necessity, but a powerful tool for promoting health and increasing life expectancy. It is important to understand that the key to truly improving the body is consistency and consistency. Single experiments with nutrition or occasional adherence to recommendations do not have a noticeable effect. The body and blood vessels need regular intake of nutrients, antioxidants, and fiber in order to gradually recover, strengthen, and work without overload. That is why breakfast with oatmeal, berries, flax and chia seeds, vegetable milk, and fruits should not be a one-time event, but becomes a daily ritual. Moreover, such a daily approach forms a habit that keeps people from harmful snacks, excess sugar, and processed foods. Consistency allows the body to adapt and maximize the benefits of each meal, turning nutrition into a powerful prevention tool. This simple, affordable, and scientifically based breakfast becomes a practical means of promoting health for many years to come, providing prevention of cardiovascular diseases, reducing the risk of cancer problems, and maintaining vital energy and vigor every day. Every time you sit down at the morning table, you give your endothelial cells, small but extremely important defenders of your blood vessels, everything they need for their normal functioning. These cells are responsible for the production of nitric oxide, maintaining vascular elasticity, regulating blood pressure, and preventing inflammation. Dr. Caldwell Esselstyn emphasized that the key mistake of most people is that they perceive nutrition as a temporary measure rather than as a fundamental medical strategy. In his opinion, cardiovascular diseases cannot be treated on weekends or compensated with pills if the daily diet continues to damage the inner lining of blood vessels. He believed that it was the sequence and not the rare healthy days that determines the outcome of the disease. Esselstyn paid special attention to endothelial dysfunction as an early and often ignored stage of the disease. He explained that a heart attack or stroke is not a sudden event, but the end of a long-term process of vascular microinjury caused by animal fats, oils, and glucose spikes. Even with normal blood tests, blood vessels can be in a state of chronic inflammation if nutrition continues to suppress the production of nitric oxide. In his works, he emphasized that the effect of whole plant nutrition is manifested not only in the arteries of the heart, but also systemically in the brain, kidneys, retina, and even in erectile function in men. He pointed out that erectile dysfunction is often an early marker of vascular problems and appears years before a heart attack, as small vessels are damaged earlier than large ones. Esselstyn also drew attention to the role of hidden fats, which many consider safe. He warned that even vegetable oils, including olive oil, with regular use can temporarily paralyze the endothelium and reduce the ability of blood vessels to expand. According to his approach, a whole plant and the fat extracted from it are fundamentally different products with different physiological effects. A separate topic of his approach was the criticism of the illusion of moderate harm. He emphasized that there are no safe doses of cheese, meat, or eggs for patients with diagnosed coronary artery disease. In his clinical observations, it was the strict rejection of these products that made it possible to stop the progression of the disease, whereas moderation almost always led to relapses of symptoms. Esselstyn also spoke about the psychological turning point that occurs in patients when they realize that their health is back under their control. He noted that awareness of the ability to influence the course of the disease reduces anxiety, improves adherence to treatment, and often leads to the abandonment of bad habits without additional pressure from doctors. Interestingly, he considered nutrition not as a restriction, but as a form of biological protection. According to him, each plate of whole plant foods is a signal for the body to activate recovery mechanisms, reduce inflammation, and improve vascular wall regeneration. He emphasized that the human body is evolutionarily adapted to this type of diet, and when it returns, it begins to work as intended. Esselstyn also emphasized that the success of his method is largely due to simplicity. He deliberately avoided complicated schemes, counting calories and macronutrients, believing that the simpler the rules, the more likely they are to be followed throughout life. His approach was based not on short-term goals, but on a lifelong strategy for maintaining vascular health. Dr. Caldwell Esselstyn has often emphasized that one of the most underestimated factors of vascular health is the frequency of meals. He drew attention to the fact that constant snacking does not give the endothelium time to recover, even if a person eats the right foods. Each meal triggers a metabolic response, and if it occurs too often, the vessels remain in a chronic stress mode. Therefore, he recommended a clear nutrition structure without endless feeding of the body. Esselstyn also criticized the popular idea of compensation. He noted that it is impossible to neutralize the harm from fatty or animal foods by adding green smoothies or vitamins. According to him, the endothelium reacts to damaging factors instantly, and no antioxidants are able to completely reverse this effect. That is why he insisted on excluding the sources of harm rather than trying to block them out. The theme of salt occupied a special place in his philosophy. Unlike fats, he did not consider moderate salt intake to be the main evil, but emphasized that high salt foods often go hand in hand with processed foods and hidden fats. His recommendation was simple. If the diet consists of whole plant foods, the need for excess salt decreases naturally. Esselstyn also talked about the role of microscopic improvements that have a powerful effect over time. He gave examples of patients in whom, after several weeks of strict plant-based nutrition, the frequency of angina attacks decreased, exercise tolerance improved, and energy was restored. These early changes, he said, are the most important motivating factor, confirming that the recovery process has already begun. The interesting part of his approach was his stance on physical activity. Esselstyn did not focus on it, considering nutrition as the primary factor. He emphasized that exercise is not able to compensate for vascular damage from improper eating. However, after normalization of nutrition, moderate physical activity begins to work as an amplifier of positive effects, improving blood flow and tissue sensitivity to nitric oxide. He also drew attention to the age factor, destroying the myth of the point of no return. Esselstyn argued that the vessels retain the ability to repair even in old age. He observed positive changes in patients over 70 and 80 years old, which proved that it is not the age that is decisive, but the environment in which the vessels are located on a daily basis. In his lectures, he often repeated that the heart does not need miracle foods or exotic supplements. He needs conditions under which the vessels stop being damaged and get a chance to recover. And these conditions are created not in the operating room or in the pharmacy, but in the kitchen, 3 times a day, every day throughout life. In conclusion, he often said that the medicine of the future would focus less on interventions and more on preventing causes. According to him, nutrition is the most powerful, affordable, and underestimated medical tool that can change the mortality statistics from cardiovascular diseases without increasing costs and risks for the patient. Friends, write down your age and one product that you are ready to give up for the sake of vascular health. If this video was useful for you, then please like it and be sure to share the link with your friends.